Hey there, Mary Sheila here, and I want to share with you today my thoughts on Ozempic because the tide has come in and a lot of people are taking it, and I want to talk a little bit about how it works in the body, but I also really want to talk about the most common symptoms that I am seeing in my clients and patients, and how to mitigate some of those symptoms, and two things that I think anybody that's on it really needs to know and to be practicing and doing, because I think it's essential for our long-term health, or anybody who's on its long-term health. So Ozempic, and there's other weight loss drugs as well, started out as a diabetes drug. It is a peptide. So a GLP-1 medication works by mimicking the action of a hormone called GLP-1, which stands for glucagon-like peptide 1 in the body. And to keep it simple, here's a little bit about how it works. Normally, when we eat, our intestines release GLP-1 hormone. This hormone has several important functions, including stimulating our pancreas to produce insulin, which is going to lower our blood sugar levels, and reducing the release of another hormone called glucagon, which raises blood sugar levels. GLP-1 medications are designed to act like a natural GLP-1 hormone. When you take a GLP-1 medication, either injected or taken orally, it signals your body to release more insulin after meals, helping to control blood sugar levels. It also slows down the emptying of the stomach, which can help regulate appetite and promote weight loss. So by increasing insulin production and decreasing glucagon release and slowing stomach emptying, GLP-1 medications help improve blood sugar control in people with type 2 diabetes, and they can lead to weight loss, which is beneficial for many people with diabetes. And as we're finding out now, more people without diabetes are taking them for weight loss since they've been recently approved for that. Overall, GLP-1 medications can be an effective treatment for managing diabetes because they help the body use insulin more effectively and can lead to better blood sugar management and weight control. We do know that there's a lot of side effects for these medications, and I personally have been seeing many of those side effects, which is what I want to talk about. But I will say, for a lot of people, having this medication now feels very hopeful, because I know as a nutrition professional that weight loss can be a struggle. It is a struggle, right? And sometimes people are really good at losing weight, but then they gain it back, right? And that's one of the problems that could happen if people come off of Ozempic or another kind of drug, is they might, gain their weight back. So I get that this medication seems like the magic pill, but I still truly believe, and I really stand by the fact that all of us, especially Americans, we need to learn how to eat right. And I also believe as a nutrition professional that most of the people I counsel, they just don't have the understanding of how food meets our physiology. And I'm only saying this because I get to hear what people are eating, how they're eating, when they're eating, all the time. That's my job, right? I help people to make sense of what's going in their body and how to make changes to help their body and their metabolism to heal. And I can usually tell them exactly why they're not able to lose weight or keep it off when I hear what they're doing. And so when I hear people say, oh, I've tried everything, and then I hear what they're doing, I'm like, you haven't tried everything, because, there's more to the story. Like you're not maybe putting in the right foods, this and that. So, and I understand too that a lot of times we know, and there's also that thing called food noise, which is kind of a new way of describing just that inability to always, not eat the things that we know we shouldn't be eating. So it could be that part of that food noise, I believe, is because we're putting the wrong things into our body in the first place. So our cravings and our metabolic hormones are just off. And so we're going to still crave those foods and we're still going to eat those foods because guess what? Sometimes our cravings are just a lot stronger than we are, right? So it really comes down to over time, and this is maybe the silver lining of Ozempic, is that it's going to help us to change our habits. If somebody's on it, they're going to have to change their habits because first thing I want to say is when I talk to people and they're like, oh, I can't binge on that food anymore because I feel really, really sick when I do, right? So that's something. When people do say that they've tried everything, oftentimes they might still be overeating for their metabolism, or they might also be having these beautiful balanced meals with the right macros, but then they're still snacking, or they're eating while they're cooking, or they're, having that little later bit of food late at night or after dinner, right? So again, trying everything means we have to examine all of those habits that we have. And again, when we take one of these medications, those habits might hurt, like the pain of it, the physical pain of overeating, right? When the metabolism slows down. So that's one of the things that I've heard from clients and patients is that maybe they're on the medication and they still binge on something and it's like, ouch, I can't do that anymore. And so they have to really start changing those habits to physically be able to take the medication and, eat foods. So good habits become essential because the appetite decreases. However, the new habits, they have an opportunity to be consistent, right? To stay the course. And even just that not having as much of an appetite, not craving those same foods, you're going to set up new patterns, right? So I want to talk about some of those symptoms that people have and that I've noticed with my people coming to me and how we're trying to mitigate those symptoms with the new medication, the side effects. And then again, I want to share the two most essential things that I hope that you're doing if you're on it. So the first thing I'll say, because it slows down digestion, people get full quicker and they can get constipated. So the first thing I'll just say is you want to be eating less than you're used to eating to allow your body to keep up with it. And I don't know if doctors are always telling their patients that, but you want to eat less. So you want to have smaller meals, right? I don't want to say eat half of what you've been eating because everybody's eating a different amount. So I don't want to cut people's calories too low, but eating less is essential. And then the other thing is, if you've struggled with constipation, you might continue to struggle with constipation, but it might feel different, which is what I've heard. So, herbs and spices can be very essential to stimulating digestion. And even something like ginger helps with motility. Staying hydrated in between meals can be helpful as well. The other thing is nausea is a big one, right? And with the nausea, who feels hungry? Who wants to eat when they're nauseous? So one of the things a few people have told me is like, I'm afraid that I'm not getting enough nourishment. I'm afraid I'm going to be now malnourished. All I've been able to eat is 2 tablespoons of food today, right? So suddenly it's a different worry or different kind of way of thinking, like, oh geez, I can't even eat anything. I have to smoke pot all day because so I'm not so nauseous, right? So 2 things I'll say about that again is like small frequent meals, but this GLP-1 hormone is given at very high doses and that's kind of how it works. But is there a way to use less? Is there a way to talk to your doctor and maybe use less, and maybe less will help you to feel better? Because sometimes people are having all those symptoms, but they're just titrating up to a dose. So there are doctors that are using it in much lower dosages. So that's something to consider because you don't want to not be able to eat, right? So constipation, nauseousness. I haven't really seen a lot of diarrhea, but I know that as a side effect. I've mostly seen the constipation and the nausea and just not as much interest in food, which for some people feels really good, right? So I want to talk a little bit about what I think is the most important things for you to be doing when you're on it, okay? So you need to build the habit of a healthy diet. You just need to, because you might not always be on it. There might be, there might be a shortage. You might come up with something and you have to get off of it. You might change your insurance and you can't afford it, right? We just don't know. It might be all recalled, right? Because there might be more side effects that we don't know. But number one is a low-carb diet that emphasizes protein and low-carb veggies is essential. You need to be focusing on nutrient-dense foods and eating mindfully, right? When you eat mindfully, you chew your food, you create surface area, you make it easier for assimilation and digestion of the foods that you're eating, right? When we're just chomp swallowing, we're not getting as much from that food because we only have teeth right here, right? So we have to make sure we're eating nutrient-dense foods, and it's just not negotiable, right? We have to change our habits. And hopefully this, the way it plays on the system is going to help you to do that. And I want to tell you too that I have a free opt-in. I want to tell you that if you click below, you can grab my breakfast report, which really describes how to have that first meal be a low-carb meal, and exactly how to do it and why, and how all your other hormones of metabolism are working, right? We owe it to ourselves to learn about this vessel so we can take the best care of it. And if you are on one of these medications, hey, this is a wake-up call to learn, right? Again, to learn how to eat, because you can build new habits and they might become lifelong, and maybe you don't need the medication anymore. The fact that they say most people get off of it, they regain their weight, is probably because they haven't really learned how to eat. So here's my invitation. Grab that and really learn, right? Because one of the things is that you're going to be eating less calories, so you need to make sure that it counts, okay? So check out the breakfast report, learn more about what it means to eat the right breakfast, okay, for your metabolism. The second non-negotiable is to weight train. So people are taking these medications to lose weight, right? But anytime we lose weight, we don't want to lose muscle. We want to lose fat. And a low-calorie diet without actively building muscles or eating the right macros, right? So you want to have enough protein, can contribute to muscle loss, right? And we know that these medications can, we can have muscle loss and a decrease in bone density instead of fat loss. So this is why the combination of weight training and making sure you're getting enough protein with each meal is essential. So if you do choose to go in this direction, or you're already on the medication, your nutrition and your lifestyle really does matter. So it's an opportunity, right? If you're taking these, to establish new habits, new routines, how you eat, what you eat, when you eat, because maybe it's easier. Maybe you don't have all that food noise. So that, again, if you are not on it, you're not going to regain the weight. You're going to have new patterns in your body that your body is thriving with, right? So it's important that you learn how to eat properly. These medications may seem like the magic pill, but your body still needs what it needs. So if you are looking for vitality and optimal health, and this is like your ticket there, you have to do your part too in making different choices that are the best for your physiology. Okay, so yeah, we learned what they are, and we also learned a little bit about the side effects that are pretty darn common. And it's also really important to just allow with the food noise gone, the appetite decreased, to do the right things day in and day out. You might have to learn how to cook. You might have to go grocery shopping more often. You might have to, maybe, learn from me. That's what I'm teaching all about, is how to eat balanced meals. But you owe it to yourself to learn while your body is not going to be in that craving place, and to eat the right foods, especially since your calorie intake is going to be lower. All right, I hope this is helpful. I'd love to hear your thoughts. I'd love to hear if anyone's on these, what it's been like for them, or if you have any other questions. Thank you for watching, and I'll see you next time. And you can subscribe to my channel and click on the bell for notifications, and I'll see you soon.